Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Doug Moynihan, the CEO of Atikokan General Hospital. So Doug, we're talking about really, as you mentioned early on, a really complex issue around health and health care. You know, it's funny, for me, a lot of it in my personal life is about relationships.
Mm-hmm.
You know, I ended up
Absolutely.
at the Merge here in town with heart pains. You know, the staff member, when I'm laying there in the bed and I'm chilly, brings a warm blanket and gives it to me.
Absolutely.
I'm now in heaven.
Yeah.
This is a good experience.
Yes.
These little things make a big difference.
Absolutely.
And so we're talking about this mix of prevention.
Mm-hmm.
How do we help people make better choices
Mm-hmm.
to prevent deteriorating health and stays in the hospital?
Mm-hmm.
And one of those issues you had mentioned on the break was medications
Mm-hmm.
and prescribing and how that works out.
Mm-hmm.
What do we know about that and how can we improve?
Well, the world of medication, drugs is very, very complicated, and as is most of these things we've been talking about in healthcare. So one of the things we're trying to do is what we call reconciliation. It's a fancy word for making sure that Steve knows the medications that you're taking and we know the medications you're taking.
Mm-hmm.
So when you come into the Emerge, you might have in your own mind's eye what are the medications you're taking. And they'll ask you that in the Emerge. So that's one list. But in that hospital, they may also have a list. They might bring up Steve Mantis, and they might have another list. Oh, when he was here last time, he was on these medications.
Mm-hmm.
Oh, well, then who's his doctor? So they might check with your doctor, and your doctor might have another list of medications. Oh, and who's his specialist? Who's his cardiac? The cardiology doctor has another list. And what pharmacy does he go to? Oh, he goes to this pharmacy. Oh, he's also been... So there's a potential of getting what we call a bad mixture of medications when the individual and the healthcare providers don't have all that together. So we're working on electronic medical records in which is a reconciliation of the medications that you're taking so that when you come in and you present in an emergency situation, we're able to immediately identify, because sometimes when you or I go into the emergency department, we're not able to talk. We might have passed out or something or been in a car accident. So medications is
or not on top of our game even just to remember some of these things.
Exactly. Early stages of dementia can easily happen to either one of us. It's another area, though. It's a bit of an issue for me, and that is in Canada, we are not well organized with regards to the purchasing of drugs. And you've heard of our Prime Minister, you've heard of our Minister, Dr. Hoskins, Minister of Health for Ontario. So in most countries, in the OECD group of countries that Canada belongs to, there is group buying. And that brings a huge benefit. It brings the cost down of medications to citizens. So drugs and medication, there's some things that need to be changed to make that work better.
And is there any movement on that front?
Oh, I think so. I think Dr. Hoskins, when he gets together with his premiers, the other ministers of health and the premiers of the province, they're talking about that. I know in our own LHIN here, we're working on trying to get all the hospitals together with their pharmacists and take a look at what are the current standards that we have in our hospitals. And we're working together, so there's one, it's called sharing our services and collaborating together. So we'll come up with what's the best practice and what's the standard that should be in place. Because a small hospital like mine or Manitouwadge, we don't have the resources to have a specialist that in each of these different functions. Now, pharmacy is just one example, but there is progress being made on the pharmacy front to make sure that we buy the drugs as economically as we can. We know the right drugs to give to the person at the right time, and then we've got standards of how to manage that medication within the hospital.
As you know, I've been an advocate for many years for injured and disabled workers.
Absolutely.
And so many people I've met and talked to have, those trays with the drugs they take. And there's like 10 or 12 drugs every day.
Yes. Yeah.
You know, and
Yeah.
I just shake my head and go, how can you ever tell how anything's working anymore? Because they all have
Yeah.
effects on you.
Yeah. Yeah.
Who's in charge? This, to me, has come back to the relationships.
Yes.
Like if there's someone that's really there with me,
Yes.
guiding me along the path, it's easier for me to take those steps.
Yes. Absolutely.
How does that happen within the hospital or within the healthcare in Atikokan?
Yeah, so it actually, it's a good question. There's a service now in some of the bigger cities, I'm not sure if it's here, where people are actually selling their services of being a wayfinder or an advocate for a citizen.
Mm-hmm.
So this is good news. If we have our parents maybe are elderly and needing some help and we don't live in the same city as they do, and they're going to the doctor, and then that example I gave you, they go to the one pharmacist, they go to a different doctor, they get all these pills. So actually it's an important piece of service or advice where we can work with some of the citizens to help them, okay, here are all your meds, who prescribed this, when did they prescribe it, for what kind of condition, and we should now make a visit back to your doctor and review all of your medications. So there is a need for that, especially with people that are getting into their senior years.
And so I go to my doctor for the review.
Mm-hmm.
How that happens, once again, that relationship, like the more that doctor knows me, and you're talking about technologically creating a data file for each one of us so that any healthcare provider could know us better.
Absolutely.
Couple that with the interpersonal piece, but then the challenges of we only have so much time
Yes.
to spend with any person because
Absolutely.
that's how it works.
Yeah. Yeah.
How do we manage that?
So there's a couple of things. One of the
And we have a minute left.
okay, so the role of the physician is being changed, and so there's some nurse practitioners, there's physician assistants. In the last 30 seconds or so, there's new technology. There's going to be little chips that they'll be giving, hopefully to you and I, that we can put under our skin, and it'll monitor our heart rate and our blood pressure and the chemistry in our body. So if those pills are not doing the right thing, we don't have to wait to see a doctor. We can be monitored, and it'll show up in some doctor's office or some nurse's office. She'll give me a call and say, Mr. Moynihan, I think you better come in and see us.
Just like the chip in our car.
Exactly.
Oh my gosh. Doug, we're out of time. Thank you so much for coming on the show.
It's been a pleasure, Steve.
You know, maybe we can get you back in the next year or two if you're still plugging away
I'd love to.
and see how our system is progressing.
You and I could talk about our aches and pains.
Well, listen, that could be a show all by itself. Thank you so much for joining us, and have a safe week, and hope to see you again soon.